we created COVID-19 risk assessment tool. And then that's something that we are asking all our employees to fill that out, not just our employees, even our clients. It's really important for both of them to feel safe, that the employees feel safe that they're going to a client's house and they'll be fine. And likewise, the clients are confident that the caregiver coming into their house is not at risk.
Welcome to Aging Choices Unfiltered. I'm Terri Sullivan, the co-founder of AgingChoices, and I'm joined by my fellow co-founder, Brenda Lamone. Hey, Brenda.
Hi, Terri. Today's topic is very relevant for those looking for senior care in these unprecedented times. I really look forward to this discussion.
Yeah, I agree. I mean, as we've seen in the news, as well as some folks that we've spoken to in our past podcast, the coronavirus has had an impact on senior living communities. With the average age of a resident living in these communities being 85 years old, it definitely puts them at a higher risk if they contract the virus. So senior living across the country is putting in measures to help protect them. Some only allowing essential workers in, others not even allowing families to visit, all with the intent of protecting the residents and their workers. As we explore this and think about other senior care options that might be available, many consumers don't choose senior communities and they choose to stay home. Or, in these times where senior communities in their area may not be having tours or having new residents move in, maybe consumers might want to consider a secondary option for the short term. So we are going to talk with Girish. I'd like to welcome Girish Lahoty, CEO and owner of FirstLight Home Care of Boston Northwest. Girish, thanks for joining us today.
Hey, thanks for having me, Terri.
Girish, can you share a little bit about your background and the services that FirstLight Home Care of Boston Northwest offers?
Sure. Well, our goal is to help every client live life to the fullest and to deliver peace of mind to their families, that their loved ones are safe and as healthy and comfortable as possible. And many times these family members, they're out of town, even on the West Coast. So, it's really important for them to be assured that their loved ones are taken care of. And we do this by providing non-medical home care in the greater Boston area. And our services are completely personalized to each client's needs, whether it's personal hygiene, light housekeeping, running errands, whatever it is. Sometimes people associate home care with senior care. Yes, many of our clients are seniors who want to age in place and in the comfort of their own homes. And every nook and corner has so many memories associated with it. But we also have younger clients, those with a physical or intellectual disability, or those recovering from a surgery or illness. And we find that recovery is so much faster at home with one-on-one care, and of course, very low chance of catching an infection compared to a facility where even a healthy person can walk back out with a sniffle or something. Just to give you a sense of what a typical day looks like, when you talk about home care, let me make it real. Our caregiver may go to a client's home in the morning, assist them from the bed to a wheelchair, take them to the bathroom to get cleaned up. Some may be incontinent, help them shower, get dressed, cook them breakfast, help them eat if need be, provide medication reminders, clean up the kitchen, make the bed, do the laundry, and maybe make some lunch for them, make a sandwich and leave that, and then go back and then come back later in the afternoon or evening, maybe take them out for a walk or run some errands for them, cook dinner and tuck them in. So, it's a broad range of services. It really depends on each client's needs, and we tailor it to, we create a customized and really individualized care plan for each person.
Girish, considering today's environment with what's going on in the world today, how do you assure clients that it's safe to allow these caregivers to come into their homes?
Absolutely. So it's a super valid concern. Even before the COVID-19 situation, it's really, you're letting a stranger in the house, you need to be assured that that person's really somebody that you can trust. And we take that very seriously. We are very selective about who we hire. All our caregivers are certified nursing assistants or home health aides. They're W-2 employees, not contractors, and fully insured. We carry a lot of professional liability insurance. We have a very rigorous screening process. We do national background checks, not just a mass query. It could be, if they've done something out of state and come here, we'll catch that. We do drug testing and driving records check. And, personally, I like to meet with every candidate we bring in for an interview and ask myself, is this a person I trust with my mom? And if the answer is maybe, we do not hire that person. It's as simple as that. I'm a certified dementia practitioner, and I also developed a special training module so that all our caregivers have the tools and techniques to better care for people living with dementia. So this is even before the coronavirus situation happened. Now with this new situation, we have enhanced our safety protocols. For instance, we created COVID-19 risk assessment tool, and then that's something that we are asking all our employees to fill that out. Not just our employees, even our clients. It's really important for both of them to feel safe, that the employees feel safe that they're going to a client's house and they'll be fine. And likewise, the clients are confident that the caregiver coming into their house is not at risk.
I'm sure you get this question quite a bit, but does health insurance cover your home care services?
Unfortunately not, since home care is considered non-medical. There are conversations happening in Washington to change that, but right now, no. But to make home care affordable, we have a few options. First, we accept long-term care insurance, which covers home care. Second, we have a contract with the VA, and we can help our veterans qualify for VA benefits. We have some special programs that can get care started for them very quickly in a matter of weeks and not waiting for months that the VA normally takes. And third, and most importantly, we do not impose hourly or weekly minimums. Many agencies require like 4 hours per shift and at least 3 shifts per week. We don't do that. We don't want our clients to pay for more care than they need.
With all the new changes, how has coronavirus impacted your business overall as a home care company?
Well, it's been an interesting mix, and it's evolving every day. Some clients pause services because they now have a family member at home to take care of them. But other clients have actually increased hours or moved to a live-in care model because of various reasons. One is they got their loved one back home from a long-term care facility to reduce exposure and social distancing and everything. And it's also that the adult children may live in a different location, and now they have the kids at home all the time, and they are busy caring for them. So they really need somebody else to care for their parents. Otherwise, they would have gone. And but everyone, especially seniors and those with low immunity, strongly advised to stay at home. Our caregivers can run essential errands for them, get groceries, and ensure proper exercise, nutrition, and hydration, which can prevent, pressure sores or other health problems down the road.
Important, really important stuff. And if you don't mind, you mentioned earlier in the podcast, you said non-medical home care, and you described that a little. But for our listeners who don't know the difference between home health, which is medically based, and non-medically based, would you mind just giving them a little rundown on the differences and the types of services that sometimes people call personal care or companion care?
Right. I mean, those are industry buzzwords that we use: the personal care, companion care. But really, if you think about it, it's all the things that people need help with, activities of daily life, or activities of daily living, as we call it, is really about all the things I described, about getting ready for the day, getting a shower, having meals, walking around. They need help, especially as you grow older. They are at high fall risk. So they need help with all the other things. Yes, you do need medical care. So for instance, a lot of our clients, we work with home health care agencies. There's a difference between home care and home health. Home health is medical, wherein they may have a visiting nurse come in or a PT, OT come in once or twice a week to check on them, give them meds, give them any injections, prescribe exercises. But our caregivers are typically there every day. And what we do is we have our caregivers observe the PT, OT, understand how the exercise needs to be done, and make sure that the client does it regularly and does it right. So we work with all the other partners. The whole thing is it's a continuum of care. And while the medical needs are there, definitely, but there's a host of other things that people need help with, the ones that I described about getting out of bed. You don't need a nurse to do that. You don't need to pay $100 an hour or whatever it is for that. So, you can really reduce costs, and by having somebody who is more of a home health aide or a certified nursing assistant do that for you.
Interesting. I think that's great information for our listeners. I know you started to kind of walk us through how you ensure that your employees and your customers are safe during this pandemic, but it would be great if you can dig into that a little more and get a little bit more detailed about that. I think if I was looking for home care right now for my parent or a loved one, I would mostly be interested in that right now because it's a very top of mind thing. So if you could share that would be great.
Sure. And it's not just about somebody who's looking for home care. It's even people who have home care right now. The clients, our existing clients, they're equally concerned, right? So, and I personally think it boils down to education, communication, confidence building, and being prepared, not panicked. So apart from closely monitoring CDC guidelines, which keep changing all the time, as you are well aware, I also participate in calls with Mass Department of Public Health, or DPH. And thanks to our FirstLight network around the country, we get on calls with owners, especially those who are in severely impacted areas like New York and California, and learn from best practices from them. What are they doing? And, there are certain ideas I may have that I'll share. And, it's a collection of, we get all our best practices and thinking together. And we've been sharing a lot of that with our clients and employees, crystallizing it, not so that, it's not information overload, but it's really about educating our FirstLight family of employees, clients, and their families on do's and don'ts, and sharing our enhanced safety protocols. And that's really, really helped build confidence. I mentioned about the COVID-19 risk assessment tool. This was something that, as this started happening, I just created one on Google Forms really quick and sent it out just so that we have time-stamped, confirmation from people about what their symptoms are or not, and, any of their recent travel history. So we have it all documented. And that's, like I said, it's really a confidence booster for both employees and clients. We've always had very strict infection control protocols. And of course, we've been reminding our caregivers to be even more diligent about following them, especially hand washing and disinfecting surfaces, and to be even more observant, to watch for symptoms, not just in the clients, but anyone in the household, because that could be at risk, or any visitors to the household, and to alert us immediately. Another change that we have made because of the coronavirus situation is we have changed our schedules a bit. Earlier we would have maybe a primary and a secondary backup caregiver for a client. Now we have reduced the number of clients that a caregiver sees, and vice versa, so that it's just one caregiver going all week to the same client and not having them exposed to multiple caregivers. And for the caregivers also, they also appreciate that, because they don't want to go to multiple clients and increase exposure and come back with something to their family.
That makes a lot of sense. And it sounds like you do have regular screening measures in place for your staff, which is really important.
Absolutely. And just to add on that, not only do we have those screening measures, like I mentioned, we are also In certain states like New York and places, I think they have started to make it mandatory for daily reporting of temperature and stuff. And so we have a mobile app that our caregivers use to clock in and clock out. We are updating that with some questions so that, make it as easy as possible for them to report, and the easier we make it, the higher the compliance is going to be.
Yeah, that makes a lot of sense. So in several states, as you know, a lot of non-essential businesses have been shut down. Does the closure of non-essential businesses impact you and your business?
No. Home care is, and I would say rightfully so, classified as an essential service. And while all our caregivers have a FirstLight badge, we decided to err on the side of caution to make sure that our caregivers can get to their clients. So 2 weeks back, we proactively mailed out letters to all our caregivers verifying that they're employed with us in an essential capacity. And 3 days later, Governor Baker issued the stay-at-home advisory. If, and that's a big if that turns into a complete lockdown, our staff would have a physical document and show to law enforcement and get to their clients and back home. And we sent this out. We informed our clients that we've done this, and I spent a good part of that afternoon signing those letters. But it's all for the good. It's just being prepared. We don't know where it's going to go, but I'd rather have our caregivers have that letter in hand in case they're asked for it.
The reason we did this podcast was to bring more knowledge to consumers to understand what goes on in the background. And, just in speaking with you, Girish, there's so many levers and knobs that are going on right now that you are doing in the background to help alleviate concerns of families. And you mentioned it earlier, that the distance between families right now, if there's a daughter or son in California and you're providing services to a parent in Massachusetts, there's a lot to think about. So tell us, are you taking on new clients right now? I imagine you're probably pretty busy, but I'd love to hear about that.
Yes, we are, but only after carefully screening them. And like I mentioned, that COVID risk assessment tool that we created, that's for all new clients, new employees, as well as existing clients and employees. And, we have actually turned down a couple of potentially risky clients. And, there was one person who called me the other day, and she said she wasn't having, I went through on the phone the checklist of questions with her. We'll obviously have them fill it out online, but wanted to just do an initial phone screen. And when I started talking to her, she said, she wasn't having symptoms, but her daughter that very morning had been rushed to the hospital with, and I said, what were the symptoms? And she said, she was having difficulty breathing and she was coughing blood.
Oof.
And I'm like, you know what? I'll need a medical clearance and a negative COVID-19 test from medical authorities before we can even do anything. And that really is about the safety and well-being of our existing FirstLight family is far more important to me than any new business.
That's great to hear because you're protecting on both sides. And you actually covered my next question, which is, would you provide care to a client that has tested positive for COVID-19? So you basically said it only with proof of medical clearance. Is that correct?
Right. Yep.
That makes sense. That makes sense.
What steps can a person take if they need home care right now?
Well, I think even the situation, we are in a very different world right now, but I think the basics still do not change. I mean, just call us, discuss your needs. We want to get to know you. We want to get to know your personality. And so that we can provide individualized recommendations, even on the phone. There are times when we get calls that clients call, I need 24/7 care. And when we start talking to them as to when are their care needs, and we realize they just need a few hours in the morning and a few hours in the evening. And, that should suffice. One thing we pride ourselves also is understanding the personality of the client so that we can assign a caregiver as a good match with that personality. If it's an introverted client, we won't set an extroverted caregiver that the client's going to be like, when is this person going to stop talking? So we have to do a good match, and then it's really that they should look forward to the next visit of the FirstLight caregiver rather than, oh my God, this person's here again.
Every single conversation we have, Girish, brings to the forefront how much how human this is. Like every person, and I've said this before in past podcasts, is that it's such a human thing. It's such a personal thing. Matching to the right caregivers, an understanding of the services that someone needs, a consultative approach to talking to these folks that may need services, and really digging in and finding out really how much do you need. And in the big picture, especially during now with this pandemic, is pick up the phone. You can go to AgingChoices and find home care for your area, or if you're in Girish's area, pick up the phone and call these folks and talk to them about your needs. It just is so apparent that there's so much going on in the background that a consumer would never know if they're not open to learning. Hence is one of the reasons why we did this podcast. So, to wrap up our go ahead. Please go ahead.
If I can just jump into that, just to add to what you just said, a lot of times people are starting home care for the first time. They really do not know how much hours of care they need. When it's like, how many hours do you need? What's the schedule? I don't know. I've never had home care. How do I know? So that's where we work with them, and we have a good understanding of what all they need to be done, what all help they need, and we'll say, all right, let's set this schedule. Say 3 hours in the morning, 2 hours in the evening, and let's give it a week, see how it goes. And then we can recalibrate if we need to increase or decrease hours or the frequency. So we will work with our client just to get them acclimatized. It's not just about forcing anything. At times, people are not used to having somebody else in the house. It can get a little frustrating to them, or, it's like they feel constrained. And we want the experience to be as enjoyable as possible.
Yeah, there's a lot of factors involved. And in that case, if someone isn't comfortable with someone in their home, maybe community-based living makes more sense, for that consumer, right? It's about consulting with them and finding out what's best for them. To wrap up the conversation, I think it would be great if you could share what got you started in home care, and any other personal stories that you have and why you started in this business.
Sure. As with most businesses, they always start with some personal experience that a person has, and that's the trigger to do something different. And in my case, it was my father-in-law. He was the most vibrant personality I ever have ever known in my life. He was the kind of personality who'd walk into a room and heads would turn. He had that kind of he was that kind of a person. And then he had an accident and he got a stroke and then dementia. And he just went downhill so quick. It was really tough for us as a family to, even fathom what's going on. And then just remotely trying to coordinate his care, it was a nightmare. And he unfortunately passed away, but, it got me thinking that I need to be doing, there are other families who may be struggling with something like this. And I've spent my career, 20 plus years creating customer experiences across channels for companies like Fidelity Investments and Liberty Mutual Insurance. And I like this, there has to be a better way to make home care more customer centric. And so I left corporate America and to do something way more meaningful with my life. And my only regret is I should have done it much earlier. But I am really fortunate to have an amazing team of caregivers who have made my vision of customer centricity come to life. And it's truly gratifying to see how appreciative our clients are when we exceed the expectations.
That's great. And many people that get into the senior care, senior living or home care industry have, had an experience that's precipitated what we've done, exactly what happened with Brenda and I. I'm going to just throw a little curveball in here because it's a question that I want to ask. Very often when we speak with folks on our podcast or even just people generally in the industry, we always focused a great deal on adult children and the family that are supporting elders. But one of the things that we are seeing a lot on AgingChoices.com is we're having a lot of older adults come to our site that are maybe a spouse. And I think with home care, one of the things that people often don't talk about, we think it's very care related, but the spouse may just need a little bit of support, a little bit of reprieve, what we call in the industry respite. Can you talk a little bit about that and how, it's important for caregivers at home that if they're part of the family, even if someone is living at home and taking care of an older adult, whether it be a spouse or a family member, why is it important for them to get a little support and a little peace of mind as well?
I think that's a great point, first of all. And I think we see that a lot, especially when somebody is caring for someone with dementia. They're going to repeat the same thing 6 times in 5 minutes. And while it's one thing for us to train our caregivers, like, look, you have to be really patient and everything, and they're there for just a few hours. The family is there 24/7. And, it starts to get on nerves and relationships can go south. And then what we tell our clients is this home care aide that's coming to your house to care for your spouse is as much for your spouse as it's for you, so that you can get a reprieve. Go get your nails done. Go have lunch with your friends. Get a life. Because it's so important that you are healthy to take care of your loved one, and both mentally and physically. You don't want to be lifting somebody when, you might strain your back. So if they're an elderly couple in their 80s, and if one has a problem and the other is okay, but they're not at the fittest level either. So it's really important for that, and it's important also that the time that they spend with their loved one is quality time. That they're not thinking about chores that need to be done. Oh my God, I gotta change their depends. I gotta do this for them. I gotta clean up. I gotta make meals. You can have somebody else do that, and then you just enjoy the time that you spend together.
Okay, well, you just gave me chills. I'm really glad I asked the question in that story specifically for dementia. My sister-in-law went through it with her mom, and I think there is a point at which they did it at home for a while, and there needs to be some mental health and physical support, for those that are caring for folks with dementia or those that have, special needs and need more support at home. So that was a great. I'm really glad you shared that with us and our listeners. So Girish, can you tell us how our listeners can learn more about your services?
Sure. Go on to AgingChoices.com and find us there, or pick up the phone, call us. Number is 781-874-9901. Again, it's always good to have a personal conversation. Even when we have people going to our website and submitting inquiries, we always make it a point to call them and not just email them. Try to have that personal conversation. But we definitely want you to check out our website. It's Boston-NW as in Northwest.FirstLightHomeCare.com. And I also encourage everyone to read our Google reviews to get a better sense of what our existing customers are saying and what kind of level of service you can get from us. And I'm proud to report that all our customers have given us the 5-star rating, and that's really heartening. And a big shout out to my team for that, what they are doing.
That's awesome. Great. This was a terrific show. Lots of really great information for our listeners, Girish. Thanks again to Girish Lahoty, CEO and owner of FirstLight Home Care of Boston Northwest, for joining the show today. Thank you so much, Girish. I really appreciate it.
Thank you, Terri and Brenda. I'm glad to be here, and thank you so much for having me. You guys are doing a wonderful job with Aging Choices, giving people, a platform where they can look at, what's right for them and help them make the right choice as to, home care may or may not be the right thing for somebody. It may be senior living, whatever the situation is. Everybody's situation is different, and you are providing that guidance and channeling them in the right direction. So thank you for the great work that you guys are doing.
Thanks, Girish. Stay safe.
Yep, you too.
Yes, be well. Thank you so much. And coming up on the next episode of Aging Choices Unfiltered, we'll be joined by Cynthia Perthuis, a certified senior advisor and elder care strategist with Senior Care Authority, as we break down the difference between nursing homes and assisted living communities. And don't be a stranger to the show. We want to hear from you. This isn't just our show about senior care options. This is your show. Follow us on Facebook and Instagram at Aging Choices or Twitter at MyAgingChoices and tell us what topics you'd like us to talk about. And please, by all means, visit agingchoices.com for a full library of senior care resources, and feel free to try our Choice Wizard, which asks you some questions and helps match you to the right care options. We thank you for listening, and we hope you enjoyed the podcast.